Hi, everyone. Welcome back to the Moms Interrupted podcast. We have Dr. Yoshi here. He's a board certified pediatrician, and we really wanted to have someone on who can talk to moms in a way where we present information and you take that and parent as you wish. And we are not going to tell people to parent a certain way, do things a certain way, but we want to get real answers to questions that are going on right now in the world and making headlines. Let's get started with just who you are, your background, and any hobbies.
For sure. So I'm Yoshi. I grew up in San Diego, and kind of awesome full circle story for me is that I went to the pediatrician where now I work.
Oh, that's cool.
So it's a pretty awesome full circle moment when that first happened. So yeah, I went into pediatrics. I thought that taking care of kids and being a part of this family dynamic is so meaningful. It's been a really awesome job for me. As far as hobbies go, I love playing sports, pickleball in particular. I don't know if you guys are dabbling in the
I've
pickleball world.
pickled.
You
My
pickled?
Husband,
Oh,
pickleball.
yeah, have your husband hit me up.
I will.
I pickled and I was confused by it because I've played tennis a good amount. And so it was hard to adjust from the strength of tennis to the pickling.
Totally.
You think it would be more similar.
You would think so, but after a little bit,
Yeah.
you start to adapt,
For
and then
sure.
you're like, "How have I not played this before?"
It's pretty
Right?
fun
Yeah.
and surprisingly athletic.
Yeah. Yeah.
Anyways,
To start, one thing I really want to ask, I have a boy who's almost 2, a toddler boy who's very crazy right now. And when I was finding a pediatrician, first of all, it was really hard for me because I gave birth at a birth center and I didn't have an OB and it was kind of alternative. So I didn't know when to go in to see a pediatrician. It was all very confusing. And then when I found one, I found that when I was asking questions, I got just a lot of negativity about asking questions and immediate, "You're an anti-vaxxer for asking a question about a vaccine," even though I was just a little concerned because my baby was sick, and so I wanted to wait maybe a week or 2 until he wasn't sick. I ended up switching pediatricians, and I love the one I got, and she answers my questions, and she is very pro-vaccine, but answers my questions still being like, "That's an amazing question. Let me answer you and tell you why you don't have to worry about this." And it just got me thinking a lot about the ways that people find pediatricians and establish a relationship with someone they have values with. And I just wanted to ask what you have found in terms of what kind of questions you get. And sometimes is it hard for you to separate your knowledge and your experience versus what moms are coming in and being afraid of? And how do you answer that in an eloquent way?
Well, first I'll say that I'm sorry that you had that experience the first time around. I feel like you're in this really vulnerable position as a parent, asking for information that is going to help you make a decision about the most valuable thing in the world to you, your kid, right? And so I hope that parents feel comfortable asking hard questions, sometimes questions that maybe are political right now, like you mentioned vaccines, for example. And hopefully, pediatricians create a space where you can ask those hard questions, right? So, when it comes to my own practice, I encourage parents to ask questions. And I say, if you don't feel comfortable based on the information that you have right now, tell me what else you need to know. Because if you're going to make this big decision, then let's do it together and let's be on the same page. And if you're not ready to make that decision, then let's figure out what information or what you need to be confident in that decision. And so I think taking a step back, like you mentioned, and finding what your values are and what you're looking for in a pediatrician is a really important step. And I don't think a lot of people think about that when they're first finding a pediatrician.
Yeah.
And then the next question is, well, how do you find a pediatrician who aligns with my values? And so, first and foremost, if you have friends or family members who have a pediatrician, then I think that that's huge, right? Because they can tell you, they can give you insight into that.
Right.
But if, let's say, you're new to a city or you don't know that many people or you don't know anyone with kids, then I think reaching out ahead of time and just getting a sense of what are some of the rules, that are part of this practice. So, for example, are vaccines required in order to be a patient in this practice? You, as a parent, have that ability to find that information out. And so I really encourage you to do that. And if you even have the chance to sit down with a prospective pediatrician, that might be even better.
Yeah.
Yeah, that leads me to a question actually, because you mentioned it, and I did see a video on your page where you did a reaction to this. Can offices turn away families for having questions about vaccines or wanting to delay vaccines or not do certain vaccines?
So I don't think any practice would turn a patient away for having questions, but I do think that there are practices that will turn away patients who do not vaccinate on time. So according to the schedule. And I think that that creates a lot of stress for families and will be really received in different ways, of course. But that's why I think it's so important to get that information up front. And a lot of people ask, well, why would you ever push those people away? And I think that there's some really hard ethical questions at play here. So, number one is that I can understand families who have newborns or who have kids with, weakened immune systems, whether it's cancer or some other condition where they can't get vaccines and they might be less comfortable knowing that there's another patient who is unvaccinated in the same office. But on the flip side, I can also understand that there are families out there who have concerns about the vaccine ingredients and vaccine safety. And so that those families should also have a space and a pediatrician who's willing to listen and, be on their team. So I see it from both sides.
Yeah.
But to answer your question, yes, you can be declined care if you don't follow the schedule in certain offices.
Yeah.
And who makes those decisions? The doctors in that practice
Yeah.
just decide as a whole, we're gonna, stick to the schedule or we're gonna allow delays and that kind of thing.
Yeah,
Okay.
it is the group will decide.
Okay.
And so this is a little different than, for example, emergency care. So, as a pediatrician or as any sort of medical institution, you can't deny medical care, but this is a preventative intervention. So there's different legal protections involved there. So just something to think about.
It's interesting with kind of shopping around for doctors in general, right? And I'm sure people have opinions about that. Some people are pro shopping around as much as you want. And then I've heard other people say, like, oh my gosh, give me a break. Shopping around for doctors, whatever. But I was one of those people that had kids before anyone I really knew well. And I had no idea where to go. And I just chose a pediatrician that was close by because I didn't know anything. But like you said, everything feels like a big decision. And just reminding the people listening that it's okay to change your mind. It's okay to learn new information and make new decisions because I went into that being like, oh, it doesn't matter who the pediatrician is. I just go in, I do my weight checks, whatever. And then I realized that I do have preferences, just a very small one, but my pediatrician's office had this crazy phone tree and I could never get a hold of anyone. And I was like, okay, I just, first off, want to be able to reach someone. And there's my first preference. So, yeah, you can shop around. You can change pediatricians. You can change, we've talked about this before, but OBs and
Yeah.
whoever is on your care team based off of what you have preferences towards and what new information that you learn or
Yeah.
anything like that. And I think that's a good call out.
Or what you value.
Right.
If your local pediatrician, whoever's, 5 or 10 minutes away from you, if they're not on the same page with you about the things that are important to you,
Right.
maybe it is worth driving a little further away to find that person who's going to be on your team.
Yeah. That's what I ended up doing. I think you too, right?
Yeah, I drive pretty far.
Yeah.
I actually changed networks. It was very random for me just because I had heard great things about this doctor, and I knew she was very pro preventative care, very into nutrition for toddlers and stuff like that, which I find so interesting.
Yeah.
And most of the pediatricians, no offense to pediatricians at all, I love them. Here's the shot, sending me home. Here's
Yeah.
what they should be on the growth chart. And I'm not bashing them because you guys have such a big responsibility and so many things to look at. And so for you to sit down with me and talk about nutrition or the benefits of breastfeeding is like, okay, Taylor, like you're asking a lot. So I get it. But then to find someone who cared about those same things as me and was down to spend that time with me, I don't know, it just made me feel excited to go in and work on my child's health together as a team.
That's the other crazy thing about pediatricians. The stuff that you guys have to cover from birth to 18, that's crazy. It's way too much stuff.
There's a lot there, totally. And there's such a shift in health issues in those different age stages. This is a huge challenge as a
I would
pediatrician.
imagine.
And I would add that I've talked to my former pediatrician about how many patients he would see in a typical
Mm.
session versus how many we see right now. And back when he was practicing, so when I was his patient, he would see on average about 7 to 10 patients in a half day session. And he was like, 10 was on the heavier side. And then when kids were sick, it was flu season, then maybe I would see 12 in a session. And now we routinely see 12 in a session. That's like the average. Sometimes we see more, maybe a little less, depending. But it just goes to show that not only has the information and the kind of the scope of practice feels like it continues to grow, but also we have to see more patients in the same amount of time. And sure, there have been things like electronic health records, which make things a little bit more efficient. But at the same time, I would love to sit down with you for half an hour or an hour and really talk about all those different aspects of preventative care. But unfortunately, in the current system, it's just not really realistic. And so
Yeah.
it's hard. You have to find other resources to fill in those gaps, or you need to make additional appointments, which is not really feasible for a lot of parents. A lot of parents both have to work or you have other kids at home. So, you're forced to go to social media or the internet or whatever it might be. And how confident are you in those resources? So, I hear you. I'm totally on the same page. I feel like we need an avenues like this, like a podcast where people can tune in and be like, I want to know what my picky toddler should be eating or how much they should be eating and when I should start to be worried. Like, that's a good example of something that I feel like I encounter a lot. And I wish I could sit there and we could really go into everything. So I hear you. I wish we could do more.
And the scope is so big, and Natasha and I talk about this a lot, but we're both breastfeeding educators, lactation educator counselors through UCSD, and we're very passionate about it. And we wanted to know, what are the requirements for breastfeeding education for pediatricians? And do you believe that when people come to you with questions, maybe the best route is to refer out? Or do you feel confident in answering questions about breastfeeding?
It's a great question. And I think the variability is going to be really broad. There is a really wide range of experience in pediatricians when it comes to breastfeeding. So I have some colleagues who are IBCLCs and pediatricians. So obviously, that's a one stop shop. They should be able to help troubleshoot pretty much all breastfeeding issues. I do not have an IBCLC, so I tend to lean on my IBCLC colleagues, with whether it's the pediatricians who are in my office or local IBCLCs in the community. And I think that I can help answer some of those more basic breastfeeding questions. But when it comes into some more complex, like specific questions, then I think it's best to work with an expert. Of course, from a training perspective, I'll rewind that in residency, there isn't a huge emphasis on breastfeeding education. And I think that kind of goes back to the question of the scope of the pediatrician. And it's just like, could be an entire additional training program, right? IBCLCs have to go through a whole training program. So why not partner with people who are experts and then narrow the scope a little bit?
Yeah, that makes sense. It's just so interesting to me because I think as babies grow, it doesn't matter as much, obviously, and kind of falls away from the scope. But it's so interesting because during the first few visits where you're seeing a pediatrician, it would seem most of the questions would be about breastfeeding. If you're breastfeeding because you're trying to regain their weight and you have all these questions about how to breastfeed and what's going on with this, and this. So it's always just fascinated me. Should IBCLCs be in pediatrician offices? What is the answer there? So,
I think that in an ideal office, you would have an IBCLC who basically goes from room to room for the moms who are breastfeeding. Because I think that would just solve a lot of issues. Unfortunately, not every office has that, but I do think that at least we have IBCLCs in the community who often will even come to the house, which I think is great because then you're in your home environment and it feels more natural than, say, being in a really uncomfortable chair at a pediatrician's office. And I think that's not always ideal. So I hear you. I want that for you.
What is the breakdown of kids that you see? I know you're seeing them throughout their whole lives, right? But what percentage of your patients are babies and older kids
Yeah.
usually?
So normally practices are built on newborns. So you start with a newborn and then you watch them grow over time. And then eventually you start to stagger where you're having a couple newborns and then a couple infants through one and then toddlers, etc. And so you usually end up inheriting other patients, whether it's they moved to a new city or a pediatrician retires or whatever it may be. So right now, my practice is pretty heavily in the younger range. I would say in the kind of toddler years and younger, but I do have all ages, of course. And so the problems obviously that come up are very different based on age. So to your point, a lot of the beginning issues in those first few years are breastfeeding, sleep, reflux, those kinds of problems. But then when we move into the toddler years, I would say picky eating is like by far the most asked about question and just is my kid eating enough? And then usually when we get into school age, I would say behavioral concerns are the most common issue. And then as we get into teenage years and beyond, then I think it shifts towards mental health. And then obesity is the other large problem in our society. So it really forces you to be adaptable to each age range because the problems are so different. And also the family dynamic shifts over time, as I'm sure you both have experienced.
Yeah, lots of shifting because I have a 3.5-year-old and a 9-month-old. And so a lot of the behavioral stuff coming up and the picky eating. You know this too. I mean, her son has no problem eating, but you should see him. I wish I could show you a picture.
understatement.
He's so chunky. The thing that I was going to actually ask you next was I know that there's all this politicized stuff around vaccines and all kinds of other things. And I'm sure you see that a lot, but it's very loud on social media. Do you see that in your day to day as much as we're seeing it online? Or is it just the loudest voice is online?
It really depends.
Okay.
I don't have anyone coming in and attacking me, or at least that hasn't happened.
Thank God.
Hopefully that stays that way. I think that hopefully people feel like we talked about earlier, feel comfortable asking their questions. And what I would say is that the number of questions about vaccines seems to be going up. So people seem to be more concerned about safety, the number of vaccines, vaccine ingredients. So, like I said before, I still think we should talk about those things and people should feel comfortable with those things. But I also think that maybe the conversations that are happening on social media are really inflating some of these intense feelings that people have. And I also just wonder how valuable those conversations really are when we're just attacking each other online. I feel like spaces where people can sit down, have honest conversations face to face, I think are much more likely to bring a benefit than comments online, which I don't know. They get
They
nasty,
get
you
nasty
know?
because you're behind a screen versus I mean, the things that people feel comfortable saying online obviously are so much more intense than the things that people would say in your office to you, right?
For sure. Or also, even in a friend group, think about how maybe you have conversations with other friends with kids, or I know that friends with kids who will ask me questions. It seems like it's a very different tone. And I wonder if, just in general, the tone online as the social media apps continue to get older and older, are we going to continue to get more and more polarized with these like harder topics? And at what point are we going to be like, all right, this is it. Like, this is enough. You
Like,
know,
not the place
this
for
isn't
this.
right.
Yeah.
Exactly.
Yeah, it's getting a little Facebook circa 2017 maybe, but this is supposed to be where we edit our pictures and
Yeah.
posted fun things.
And I think that really our goal should be finding people who we trust so we can have those vulnerable conversations with them. So try not to read the comments online. Try to find people you trust and ask them the hard questions. Find a
Yeah.
pediatrician you trust and sit down with them. And if you need more time, figure out a way to have more time with them. That
So
would be
now
my goal.
so now that we've established we trust your answers, I'm gonna ask some of the hard questions.
Hit me.
Since we were already on the subject, I'm gonna dive right into vaccines. This has been all over the internet. Can pediatricians get more money for more vaccines that they administer?
It's a good question. So I want to break this down because this comes up all the time. So, number one, I think people say doctors are paid by big pharma to give vaccines. So, first, there's a law that states that any doctor who takes any sort of financial payment from a pharmaceutical company or medical device company has to report that. So you can look up your doctor right now and it'll state that they have taken payments from this pharmaceutical company or whatever. So we actually, as pediatrician offices, pay pharmaceutical companies to buy their product. Okay, so that's number one. Number two, generally, pediatrician offices either break even or lose money from having vaccines. And that's from storage and that's from administration, handling in general. You might have vaccines, they might expire. That's money that's lost. Okay. And then the last part of it is incentives. So many pediatricians do not have any incentive at all. There's no additional payment that they get. They give vaccines because they believe in the vaccines. Now, there are some insurance companies who provide incentives for vaccine uptake. And if you hit a certain percentage of kids who are vaccinated on time, then you will get a small incentive payment to your practice. I think that thinking about how much insurance companies deny care, you got to wonder, why are they actually doing this? And at least my perspective has been that the goal is to have kids be less sick. And if a kid gets hospitalized for an insurance company, that's going to cost a lot of money. And the goal really would be, if we could give a cheap vaccine, prevent them from getting sick, then overall, it's better for us. Now, I don't
Wow.
think a lot of people think about it that way, but that's how I've started to think about it. So
Yeah, I can't believe there's insurance companies that are pro preventative care.
I know. Wow. But I'll also add
Yeah.
that this is not just for vaccines. So insurance companies will incentivize you to provide high value care in general. So if you do developmental screenings at appropriate intervals, you also have an incentive to do that. If you track kids for obesity and then you intervene at an appropriate interval, that's also incentivized. If you do depression screening for adolescents every year, that's also incentivized. And the goal is, if you intervene before something becomes a problem, then hopefully later on, that'll actually be better for their health primarily. But as an insurance company, will also save them money.
Yeah, that's interesting. It's just so funny how you can see things come out on social media and no one really understands. I didn't understand how that worked.
Right.
And just breaking it down so simply is so important. And another one that comes up a lot that isn't about vaccines, but is the same question is a lot of people wonder if doctors can be paid via formula companies to promote, if there's any laws against that. You'll see doctor influencers online promoting things. Are there laws against this, or can they just do what they want?
Actually, formula companies have reached out to me to promote their product on my social media, and I have turned it down. And doctors can have formula in their office. Oftentimes, formula companies will offer free samples to them, and they may sponsor, let's say, a lunch for that pediatric office, and they'll do an informational session. But as you can imagine, there's clearly a conflict of interest if a formula company is directly paying a doctor to give their product out. So I would say if you have any question about that or going back to the vaccines, ask your doctor. Are you incentivized to give vaccines? Are you incentivized to give us this formula? And if you don't like their answer, then maybe that's something that you should take into consideration for finding your next pediatrician.
I
Yeah.
think that there's a lot of mistrust around doctors and medicine in general right now. And I think that's what, from what I've heard, stops people from asking questions because they just don't believe the answers. Even if they have the questions, they're like, I'm not going to get the truthful answer anyway. So why even ask?
I will say sometimes moms, when they're in such a vulnerable state
Yeah.
and they aren't educated in this world,
Right.
don't know how to ask the questions or that they can ask the questions.
Absolutely.
And that's where I find such an issue in doctors taking money from formula
Of
companies.
course.
Because if a mom really does want to breastfeed and doesn't know how and is asking questions and instead is offered formula, then that's a really sad missed opportunity for that mom and that baby. And I am all for formula if that's what you want to do. But my heart hurts for the moms who that's not what they want to do. And they're given this option that seems easier in a time when they're really struggling.
Yeah.
It's a missed opportunity for education
Yeah.
and like a referral out to.
And it comes back to money, which I don't like.
And I think that these are valid points. And I think that hopefully with this podcast, people feel comfortable asking these questions. You're allowed to ask these questions, and hopefully you'll feel confident in your pediatrician's answer. But at the end of the day, we do have to at least make some money as a pediatric practice. Otherwise, we can't stay open. But it shouldn't be at the expense of a family, in my opinion. And so I think we should promote breastfeeding. We should promote lactation consultants to be able to work with families. But then we should also, if that's not working out or if a family is looking for an alternative, then there should be an honest
Course.
conversation
Of
about
course.
formula.
If a mom asks for it, for sure.
Yeah.
What we have a problem with is predatory marketing. And we've just seen some crazy things. What was that one that we saw on Instagram? Someone saying that they were getting a hunchback from breastfeeding. So they decided to do formula instead.
This was a real swipe up if you
Yep.
don't want a hunchback from
We
breastfeeding.
were like, what is happening?
And then another one was I made sure to have this formula and it saved my baby's life because my milk wasn't in at day 2. And I was like, milk isn't in at day 2.
And also,
And
you have milk, it's colostrum.
so that's predatory marketing because these women don't know that because they're not in the world of breastfeeding. And so it gets really dangerous. And of course, that's all social media and all subjects, but it just boils our blood because we're lactation educated.
And we're like, no.
Can we normalize that if people have a link in their bio to a product, we should immediately pause, right?
100%.
And that should be true of all social media, right? No matter who the person is, even if they are credentialed, if they are recommending a product that they are selling, then maybe we should pause for a second. And then this should be your opportunity to be like, let me go find my trusted healthcare professional
Right.
and ask them their opinion. And so we need to be, as pediatricians, that person for people. And then for you as educators, you need to be that really trusted individual.
Right.
I love that.
And I think getting educators and experts together and just very simply and plainly explaining how, like you said, the practice works and how vaccines work and who's incentivized and how people make money, just getting that information out there because, like we said before, there's so much noise and there's so many people who are not credentialed and not experts slanging products and saying whatever, their opinions, but that stuff is very loud. It's very noisy. It's attention grabbing. People are selling stuff, so they have incentive. So it's just hard to sort through all of that stuff to get to the actual information. And like you said, reach out to your pediatrician and ask a question instead of believing people on social media.
Yeah. Or at least, like I said, take that extra time or find an opportunity. Be like, hey, can we set up another appointment where we can talk about this in more depth? Because that's what we're here for. And if your pediatrician is like, no, this is what I feel, then again, maybe consider if there's someone else who's better for you.
Which makes you just feel very in control because, like you said, all of those decisions, especially the first time around, feel so big. They feel like huge decisions. And like looking back, I was so anxious and scared of everything. But like you said, it's your baby. It's the most precious thing in your life to you. So it is a big decision in that moment. Knowing that you're in control and you have a voice and you can shop around and you can ask questions, I think is makes everyone feel more confident.
Yeah.
Yeah.
I want to ask about food allergies.
Ooh.
Have you been seeing more and more food allergies in your day-to-day practice? My son had a crazy egg allergy, and I find it so fascinating that that's pretty common for egg and dairy allergies. And I'm just so curious what your protocol is when that happens.
I want to lead by saying that I work in two clinics, one that takes care of mostly immigrant families, and I haven't seen a single food allergy there,
Wow.
which really is took me aback the first time that I reflected on that because in my other clinic I see families, mostly kids born in the US, and I see food allergies every day. And so I've always wondered what's going on here and what types of differences are we seeing in these different populations. And what we've also seen is that as families immigrate to developed countries over a generation or two, food allergies start to rise. So something's going on here. And I have a lot of questions. Obviously, our habits, our lifestyles, our exposures are very different than some other countries. To go back to your specific situation, food allergies are a huge challenge, right? It totally changes your life. You have to avoid this food or food group potentially. So the first step is how severe was the allergic reaction and when did it happen? Fortunately, for a lot of kids who do have a reaction, there is a chance that they're going to outgrow that food allergy or that reaction. But the safest thing is to go to a specialist that is able to track you and your family. And if we're going to do a food challenge, do it in a safe place where if there is a true reaction, we can act on it right away. And then the next step there would be if we do have a reaction, is there some sort of intervention where we can reduce the severity or potentially outgrow it? So, is there an oral exposure therapy, intervention therapy that we can do that will help that kid in the long run? Because let's say, even if you're exposed, if you weren't trying to be, maybe we can make it so you're not ending up in the hospital and you just have a really bad rash, which still isn't great, don't get me wrong, but at least that's more manageable.
Better
Yeah.
than anaphylaxis.
Yeah, for sure.
Yeah.
Of course.
That is so interesting. I feel like my mind was just blown. I just makes me think it's the environment we're in or something where you
Or food source, something. I
That's
mean,
really cool. You should do a study on it
Yeah,
and
totally.
report back.
Yeah.
Yeah, I've thought a lot about it.
we'll have you back on.
And even to go back a little further, people ask about when did food allergies start to rise? And actually in the early 1990s is when we first started to see this uptick in food allergies. And at that time, there was a lot of changes specifically in the US, the UK, Australia, these industrialized countries where things were changing. And the guidance at the time was we want to delay the exposure of these allergens, as a lot of people know. So it was delay dairy until one, delay eggs till two, and delay peanuts till 3. And so we started to see over time that food allergies continued to go up despite this guidance. And we ultimately learned in the kind of late 2000s or 2010s that with high quality studies that actually early food introduction is much more beneficial. So the guidelines have really changed even in the last 10 or 15 years. And we've seen that the number of food allergies are starting to stabilize, but obviously there's still a high rate, and actually about 6 to 8% of kids in the US have a food allergy. So, still a lot of research to be done, but to my earlier point, there seems like there's some exposure or exposures, or maybe even a lack of exposure
Mm.
that we need to be thinking more deeply about. So, more to learn.
Just for clarification, is there, when you're talking about a food allergy, what is the definition there? What kind of reaction are we looking at?
Yeah, so there's generally two types of food allergies, right? So there's anaphylaxis, like you pointed out, which is by definition having like a systemic reaction to a allergen. So you'll have hives, so some sort of skin reaction, and then you will also have either one of difficulty breathing. So you could have wheezing, you could have a GI manifestation, so you could have vomiting, persistent diarrhea, or you could have a change, something neurological. So your blood pressure can drop. You can become very lethargic all of a sudden. So your neurologic status changes. So that's the definition of anaphylaxis. There are some kids who have a reaction, but it's just hives. And obviously that's much less severe. But there's always the concern that could that become anaphylaxis with enough exposure or another exposure. So we take both of them seriously. Now, all that being said, there's something called oral allergy syndrome, which is basically a reaction to the food around the mouth, which is more of like a irritation than a true food allergy. So that sometimes is mistaken as a food allergy. So the point of all this is to say if your kid has any sort of reaction, obviously it's a good idea to talk to your pediatrician, and sometimes we'll do additional testing to really pinpoint what you reacted to.
Do you think that there's any, people talk about this in relation to other things too, but do you think that there's an increase in diagnosing food allergies that has affected the percentages that we are seeing now in your experience?
It's possible, and maybe we are just now defining it much better. But I think that the other challenge is that kids grow out of these. So maybe if you were exposing your kid to something, they had a mild reaction, you just kept exposing them. And then maybe it wasn't something that was ever going to be severe. And maybe now, because there's more awareness, people are much more likely to see their doctor, get a diagnosis, avoid that food, follow a more stepwise reintroduction, then maybe. But I think overall, the number of hospitalizations from anaphylaxis did go up significantly. So that's enough to tell me that at least the severe food allergies had been on the rise.
The reason I ask is because when I was a kid, people would be like, "Oh, Susie can't eat tomatoes because her tongue blows up." But like, were parents taking their kids to the doctors back then and being like, "She has a food allergy," or were they just like, "Don't give her a tomato. She's a little uncomfortable." So that's why I asked.
That makes me think, though, and I'm sure this is what you were thinking of when you said this, is now all over the internet this past year, the rate of autism and the headlines that has made, especially in California. I believe now it's 1 in 12 boys in California have autism. And there's this huge debate, right? Are people just getting better at knowing the signs and diagnosing, or are you seeing in your practice that there really are more people with it? And is that something you have to communicate with parents all the time? Do you see it all the time?
I don't know that I've practiced long enough to see the true rise in number of cases, but what I will say is that we are much more in tune to looking for signs of autism. And even thinking back, so the diagnostic criteria changed in 2011 for autism. And the whole purpose of that was really to get more services to kids who needed them. but I think that also may have changed the rate significantly. And so I would take that into consideration when thinking about the numbers. And don't get me wrong, they have certainly gone up. So there seems to be a question as to what is the cause or causes of the rise. And to some degree, it is, just a diagnostic difference. But I will say I have talked to experts, and they say that even though the diagnostic criteria have changed, that they think that there is some factor that's increasing the amount of autism. So
That makes sense.
It's interesting, right? Because you have more kids with anaphylaxis in the hospitals, regardless of what has changed as far as diagnosing, and then also higher rates of autism, regardless of those same factors. What has changed so that these things are increasing so much? And of course, people will blame it on vaccines or our food source. I mean, maybe it's everything. Maybe
Right.
it's the toxic load in general. Maybe there's more pollution. Who knows?
I also wonder too if there are certain people who are predisposed, and then there's some environmental factor that really pushes them into that diagnosis. So maybe you wouldn't have had this condition had you been living without these exposures. But now that you do have them, unfortunately, it's led us there. So I also wonder if research needs to be done into looking at subsets of populations who maybe are more sensitive. And I think about this specifically as it relates to vaccines. Are there people who are more likely to react? Or when it comes to medicines, are people likely to have side effects when they take a medicine compared to somebody else? And can we document this so that people can be treated in a more personalized way? And I actually talked to the head of the Institute for Vaccine Safety, and he was like, we need to have a personalized vaccine schedule so that, the right patient is getting the vaccine at the right time. So they're least likely to have a reaction. And I think this would be true for any sort of medical intervention, but that's a humongous undertaking and would cost a lot of money. So we need to find out how we can prioritize that kind of preventative care. So hopefully we'll get there eventually, but still a lot of research needs to be done.
You would think that with the genome sequencing technology and companies fighting to make that more accessible, that we'll get there at some point. Obviously, it's cool technology to think about personalized genome sequencing and the research around that and how that will affect your practice.
Absolutely. I do wonder though, with that data, there comes concerns about privacy, right? We do newborn screening right now, but what if we instead did whole genome sequencing of every baby that was born? Sure, we would have a ton of information and maybe we would be able to intervene or prevent certain conditions. But also, is that, I don't know, as moms, would you allow your kid to have their genome sequenced? At, let's say today, a doctor said, would you do it?
I think I would.
I think I would too, because I'm just a geek on science and information, but I don't know what the implications are
Right.
long term. So, what am I signing off on? I don't think we know what you're getting yourself into. So, it's easy for me to say, yeah, I want all the info, but then look at what's happening with 23andMe.
I think it's cool though that doctors and people high up, you said the Institute of Vaccines, are thinking about those things. It's just such a bummer because those could be life changing. But because of today's political environment, those types of conversations, talking about changing the schedule or making it more personalized, has become the agenda. And it just feels like we're losing sight of why people are asking questions about the subject in the first place, which is to make kids healthier and to help our population. And it's just such a bummer.
It's a bummer when things get politicized because what it all comes down to is people caring about their kids and medical professionals caring about science, and
Yeah.
it just gets muddied.
And looking into
Uh,
things can never do any harm. Looking into how certain kids react to a certain schedule, that could only bring good things, even if the data shows that actually there is no difference.
It's very political right now. It's hard.
yeah.
Is
Yeah.
the clear answer, but to your point, let's keep researching. Let's keep trying to learn more because at the end of the day, we're just trying to help kids.
Mhm.
Yeah.
Yeah.
think we moved to the true or false game. I'll go first. Okay. True or false, it's important for babies to crawl before they walk.
This comes up a lot, and I think it's really from social media. I would say false, but there may be evidence that crawling is a sign that there are kind of development happening in the cross body movement. And so that cross body movement is a really healthy developmental growth stage. Now, some kids don't necessarily need to crawl in order to develop that sort of cognitive ability, but sometimes if kids go straight to walking, that might be a sign that there's something developmental going on there. So, what I would say is if your kid goes from just sitting to walking and skips the crawling stage, I would just bring it up to your pediatrician, make sure that there's not something else going on.
Get off of
Recommendation.
a milestone list that I know a lot of pediatric PTs were upset about that because there weren't any PTs on the board that made that decision.
Yeah, I don't know specifically why they took it off. I wonder if it was really driven by pediatricians who had families coming to them being like, my kid didn't crawl. What do I do? And most pediatricians being like, it's fine. We don't have to worry about this. But I don't want to dismiss it because I also acknowledge the fact that if you don't crawl, it's something we should take into consideration.
Yeah, makes sense.
Yeah. This is one that drives me crazy, but growth charts aren't perfect. True or false?
True. Does that make you feel better?
Yeah.
Yeah.
Yes, because both of my kids have been slow gainers. And then at a certain point, they catch up, but it's always been a very stressful first 6 months. And especially with my first, trying to breastfeed, and people told me I needed to supplement. And with my second, she never took a bottle. Anyways, I think that growth charts can be super stressful for a lot of moms, especially early on, especially the first time around. When my pediatrician told me, oh, he's gaining a borderline amount of weight per his growth chart, but we're not worried. I was like, well,
Yeah,
I'm worried now.
makes me worried.
I
So,
think that we just don't want to catch you off guard
Mhm.
if there is a true plateau in growth,
Mhm.
because if a baby stops growing, then we do need to take that very seriously because sometimes that's the only indication that there's something going on. It's something to keep a close eye on when the growth isn't what you expect. But to your point, there are kids who just grow that are slightly different than the expected growth chart, and that's okay.
yeah.
Yeah. Okay, next question.
Okay.
Hep B vaccine for newborns is to prevent STDs, so it's not necessary at birth. True or false? This has been all over the news lately.
Yes. So I would say that hepatitis B shouldn't necessarily just be characterized as an STD because it is also transferred through bodily fluids. So it can be through a blood transfusion or it can be through any sort of direct contact with like a wound. So, while yes, I think that we should take that into consideration, I would also just broaden our perspective on what hepatitis B is. To answer your question, should it be given at birth? I think that in the beginning, that started as a recommendation to reduce transmission from moms to babies. And if you give the vaccine and if you give the antibody right as the baby's born, it significantly reduces the risk of transmission. Now, we test for hepatitis B. And so, in theory, you would pick up on all moms who have hepatitis B. So, should this be a risk based approach? And some countries do that. They do a risk based approach. So, I wouldn't be surprised if the guidance on this changes at some point. But I also think that generally people think that this vaccine is safe for most babies. And so you're weighing these two very small risks. And so which one should you go with? And that's a really hard decision. So I think you should talk to your individual provider about
Mhm.
it.
I love that answer.
So, if kids are getting Hep B, is it certain populations that are more at risk, like kids that are in daycare versus have a stay-at-home mom, or you know what I mean? How do you weigh making that decision if you should get your newborn
It's
vaccinated
a good
or
question. I would say that you don't always know who has hepatitis B because there is chronic hepatitis B and there's about 1 million people in the US who have it. And so if you know that there's a close family member or friend who's going to be around a lot who has it, then I would say that's definitely something to take into consideration. You don't have to disclose your medical history to a daycare necessarily. So you may not know if some other parent or caregiver has hepatitis B. And so that's why I think the guidance came out was let's just protect all of these kids from all scenarios. But I know it is nuanced and I know people are concerned about this vaccine, especially giving it to a newborn. So it's a hard one to answer, but I think talking to your individual trusted healthcare provider will hopefully help you make the right decision.
True or false? There's not a lot of research behind helmets to solve plagiocephaly.
That's a good question. So there is evidence that mild plagiocephaly does not necessarily have any difference in outcome from a helmet, and that it's likely that without a helmet, you would look the same as with a helmet. And then moderate to severe plagiocephaly, though, there is evidence that the helmet can help. And so I would say if you're seeing a very significant flat spot where it's very asymmetric, then I would bring it up to your pediatrician. And in some cases, it can actually impact your baby's development. So if one side of their head is significantly heavier, then maybe their ability to kind of move and gain that development could be impacted. So those are the cases where it is recommended.
Do you like, say, PT or Chiro early on, like before the 6-month mark when kids can get a helmet? Do you like that at those earlier ages to help move the needle?
I would say usually when there's evidence at a 2 month or even sometimes at a 4 month visit, I say, why don't we try some tummy time, movement of the neck, things like that, seeing if that shows us improvement between that visit and the next visit. And oftentimes there is improvement. So try to push us down a little longer. But if we're looking very severe by 6 months, then I usually say, all right, let's just have an evaluation done.
Yeah. I've had a few friends actually do the helmet, and obviously the helmet is low risk. It's not risky, but the thing that was concerning that I heard, and this is just word of mouth, but the people who are diagnosing that the helmet is needed are PTs that are employed by the company. So they're incentivized to sell helmets. And so is that really an unbiased recommendation?
But also what's happening too, I've talked to a pediatric PT about this, is a lot of the times she says that a pediatrician will say, well, let's wait it out, right? Let's wait it out, see if it gets better, and then we'll do the helmet. But the issue there is you're not doing PT to correct or
Mhm.
try to make it better so that at that 6-month appointment, you don't need a helmet.
For sure. I think that it would be worth your while to have the conversation with your pediatrician at every visit. And ideally, you see a provider, a PT, or whoever it may be who is not involved in the decision on the helmet
Right.
before deciding on the helmet. Because I typically refer to PTs who are not part of the helmeting process.
Right.
And so
Mm.
they can give what I feel is a more unbiased recommendation.
Yeah.
But I know not everybody has that option. So
Yeah.
it is hard.
I want to ask one more question. A video just went viral of a woman CEO of a company in the UK who was in the fashion world. And she said on some news outlet that breastfeeding after 6 months has absolutely zero benefits. Is that true or false?
False.
She also said that it was
Selfish.
for the mother and creating an addiction for the baby.
False.
Insane, right?
Oh
Insane.
my God.
Yeah. Yeah. So that just went viral. And I think
One,
that's
but
mic drop on that one.
but really this has just been so great and
Oh,
it's so nice to sit down with someone who has your expertise, yet is willing to answer all these questions in a way that makes us feel comfortable, makes our listeners feel comfortable.
and someone that we trust. And so thanks for coming and chatting with us. And I've truly learned a lot. It's so awesome to be able to have these conversations and learn about how things work. So we really appreciate you.
Yeah, thank
Thank
you.
you both for having me. I appreciate that you're making this space for parents to be able to ask these questions, to have education that's based on evidence, and hopefully we can have more of that. So keep up what you're doing. I appreciate both of you.
Thank you.
We could sit
Thanks.
here for hours.
Thank you everyone for listening.
Yeah, thank you.